So, should the federal government move forward with the proposed $880 billion cuts, according to what we've talked about earlier, we could possibly see a drastic cut in Medicaid funding at the state level and our ability to provide that service for people, correct?
That's correct.
Okay. So if those cuts happen, then that means that many of those people would no longer have Medicaid coverage, which means that the hospitals and doctors' offices that they go to would not be reimbursed for their services, correct?
Correct.
Many of those places are in rural parts of Pennsylvania that already have a shortage of hospitals and health care in those areas, and those hospitals would therefore be overburdened with folks who they're not going to get reimbursed for, correct?
Correct.
Would you also agree that that would mean that many of those hospitals and healthcare centers would probably in a few years find themselves maybe either limiting their services or closing their services?
Yes.
Okay. In addition to that, should those cuts come down from Washington, D.C., the $880 billion proposed Trump cuts, would that have an effect on our child care workers and our child care providers and our ability to pay for those services as well?
Well, it would have an effect on the individuals who were Medicaid enrollees. They could potentially lose their Medicaid. Our funding that pays them is a different line, not tied to Medicaid.
So those parents, those direct care, service providers, as in like the child care workers,
right, they
themselves could lose health care coverage, and their children could possibly also lose health care coverage, correct?
That's
so
correct.
That means now that child that gets sick can't go to the doctor, so mommy or daddy would probably have to stay home and take care of them.
Yeah.
So I say all this to say, it is very clear that should these cuts happen, it would be drastic for our Medicaid population, which, according to what you said, is 3 million Pennsylvanians, correct?
It will be catastrophic.
Catastrophic for the 3 million people. I would say, so catastrophic to the 3 million people, but it would probably be, we probably wouldn't recover in rural Pennsylvania because many of those healthcare providers and hospitals would close because they would have to provide services by law to folks who no longer have healthcare coverage, correct?
Yeah. It would take a situation that is already very difficult from a budget standpoint for rural hospitals and make it much worse.
So it is clear that nobody who represents or says that they care about rural hospitals could support the $880 billion in possible cuts to Medicaid.
Certainly not here in Pennsylvania.